All right, next announcement. This is one that's been reported on just a little bit, but I haven't been able to talk to. It's our Eastern Kentucky Veterans Center. There are 9 veterans and 1 staff at the EKVC in Hazard that have tested positive. This is our first veterans center, I believe, with an extensive outbreak. But thankfully, the cases are still confined to 1 hallway of 1 unit. All veteran cases traced to 1 transport aide who has left the hospital and is recovering at home. In an overabundance of caution, all positive veterans have been sent to the Appalachian Regional Healthcare, and they've agreed to keep them until either a negative test or 14 days has passed. This also gives us the ability to put everyone in their own room, since 9 veterans are out in the hospital. The center is testing all veterans in that unit today, and the rest of the veterans in the facility tomorrow and Wednesday. So steps that are being taken are barriers between the 2 hallways of the affected unit, and to ensure staff come in separate entrances so there's no cross-contamination through staffs. Consistent staffing on the hallways so staff don't take care of veterans in the other hallways. Deep terminal cleaning of the rooms, ongoing audits and retraining on all infection control procedures and PPE usage, cancellation of all non-essential appointments, working closely with both local health department and state department for public health, and continued testing. The entire facility will be tested by the end of Wednesday. We don't want to see any long-term care facility have a COVID outbreak. This is one of our veteran facilities, and so we are taking it just as, if not more seriously. We want to be transparent about it and let you know that we are working very, very hard to address it. All right, today's COVID update. This is a typical Monday where cases start out smaller, though they're no longer ever small if we take ourselves back a month or even 2, and then they grow as what we have right now are very few labs that are open on Sundays. So today we're reporting 373 new cases of COVID-19. After our daily duplicate removal and audit, our total number of Kentucky cases now 43,899. Our positivity rate continuing to be below 5%. We have a lot of things out there that are concerning. This is a good thing. It means that people are being tested. We need it to continue to come down and to come down more, but today it's at 4.77%. As of today, we have 564 Kentuckians in the hospital for COVID-19, 149 in the ICU, 82 on a ventilator. I believe that's lower than the numbers previously, but even I know somebody that's coming off a ventilator for the wrong reason. So remember, when those numbers are down, sometimes it means we've lost or we're losing someone. We've now administered over 822,904 tests here in the Commonwealth. The breakdown of what type of tests those are on the website. The large majority of them are the PCR tests, which we believe are the most accurate. New cases by county: Fayette 93, Jefferson 69, Warren 21. 3 more school-age kids in Warren in today's report. That's 8 in the last 2 days, more than 19 kids under 18 in that county in the last week. I hope that there has been significant contact tracing and that these 3 kids didn't walk into school today. Madison County 18, Callaway 13, Davis and Hardin 10 apiece. Today we've also lost 4 additional Kentuckians. And I don't want to give anybody false security, because we are seeing significant losses during this month that, today is 4 and that's low. We have 19 pending in front of our committee. Remember, we have a committee that looks through, that ensures that COVID is a contributing factor, that if you're in a car crash just because you had COVID, you're not listed as one of these losses. So today we're recognizing the loss of a 76-year-old man from Harlan, a 94-year-old woman from Jefferson, an 82-year-old man from Jefferson, and a 71-year-old woman from Marion County. Today, we're also posting for the first time online reports on schools and universities and the number of positive cases recovered and other detailed information. If we could start with K through 12, this is going to be, and it's more colorful online, maybe you can see it on the screen, a look at what the in-depth report shows. We're also working, this in-depth report goes through our EPIs for its accuracy, which means it lags at least a couple days. And what you may hear on the news, and you're going to hear things on the news. If the school is doing things right and advises parents, you're likely to hear on the news before you see it being reported by us. That's a good thing. That means people are being transparent, and we need schools to be transparent. We're going to have a dashboard, though, that's created that is faster than the information you're going to see here. But what you'll see is that there are at least 31 different school districts that have had, not that currently have had at least one positive related to the district. This shows you how many are recovered and how many are active. So in our school systems right now, we believe that there are at least 50 active cases. And this again will be updated, and as more schools go back, unfortunately, if they're going back too early, I believe that this is going to be populated very quickly. We've already seen a number of schools that have started, shut down. The one public school system that had started before this week has switched to NTI, and that's the right decision if they have positive cases. And I don't want to go back to the initial decision. If they made a good decision to protect their students now, then good for them. We're going to be tracking this because parents deserve to know, and there are even breakouts that are more detailed than this. Show our universities. We're also going to be tracking our universities across Kentucky. They show right now that there are over 223 active current cases at our various universities here in Kentucky. Again, you will see some discrepancy in the data as schools report faster than it goes through our EPIs because they've got to go through their process. So when we have our dashboards up, it will look closer to the breaking news that you all are seeing. Kentucky Child Care Facilities. Sadly, this continues to increase. 10 more facilities, meaning we've had at least one COVID case related to 158 child care facilities. 10 new staff have tested positive, and 3 new children. We hope everybody gets better and gets better quickly. Long-term care facilities, 4 new residents, 4 new staff testing positive, 4 additional deaths, all residents. 5 new facilities have had at least one positive case. Again, there's been so many cases, we tried to reconfigure this to show how many active cases there are. So one of the hardest things that I do in this is when we're able to put a real individual to one of these deaths, to try to remind people that we have Kentuckians dying that we love and care about. You might not know one. I do. I know I'm going to know 2 here shortly. Please take this seriously. So many of these families will say, as a dying wish to my dad, my mom, my grandparents, please take this seriously. And so to folks out there that still don't want to wear a mask, just listen to these families. Nobody wants to go through the loss that they are going through. And you might not believe it's real, but they sure as heck do. So today, we're remembering Rob Perry of Carter County, who lost his battle with COVID-19 at the age of 56. Perry was a lifelong Carter County resident, a devoted father, husband, son, and brother, and a preacher dedicated to the people in his community. Perry left behind his children, Tyler and Destiny, his wife, Tawana, and his 80-year-old mother, Sonia. Nobody's mom should have to bury their own son. It happens too much in this society for so many different reasons. Rob's brother Chris is a state park manager and shared his brother's story, saying, "These past 4 weeks have been the worst of my life, not being by his side and not having the ability to say a proper goodbye." Chris shared his brother's last text to him, stated if he survived, he would never leave home without a mask again. That's this individual's last text to his brother. It makes me think about, I have one brother. What would your last text be? Not knowing it's your last text, what would it be? I know Chris is sharing this story in part because of this. Rob's family asked we hug our loved ones tonight, wear our masks, and social distance. So today, I'm going to wear my mask for Rob Perry, his brother Chris, and the entire family and the entire Carter County community. I guarantee just about everybody in Carter County knew Rob and have experienced his loss. All right, I want a little bit of positivity, and then we're going to move into our last topic, and we're going to hear from Dr. Stack. You know, I'm worried about the point we're at. I'm worried about it. I mean, we saw ourselves be able to keep ourselves at a plateau before, and then it spun out of control when we let our guard down. And now we're at a much higher plateau, and God knows we don't want to see, if we have a similar increase, where with even our best efforts that next plateau is. But there are folks out there that are continue to fight the good fight every day, and I want to look at a little bit of the positive that is on social media. So first, I love this one because I haven't seen Kenneth Mansfield in 3 months? You know, Kenneth is one of those employees that, based on his family and health, has been working from home. He's actually manages the overall broadcast that you're watching, but I miss looking at him wondering when the next slide is going to be up. Right, Kenneth? But I love that folks out there have never abandoned Kenneth, and I think have determined that James does not exist, and still call for Kenneth. Let's look at this next one. This one is really special. This is Marley. She is a 16-year-old junior at Henderson County High School, and she wants everybody to fill out the census. Look at all of this work. At 16, grasping the critical nature of the census, wanting to help other people out, doing what is far and beyond the civic duty of a 16-year-old. If you don't want to fill out your census for me, how about filling it out for Marley? Because so much of the world that she is going to, I don't want to say grown up, she's a 16-year-old, but she's going to live in is going to be determined by the dollars this census is going to set out for the next 10 years. All right, next one is another staycation or vacation in Kentucky. Quick overnight getaway to Lexington for Eddie and his wife. Opportunity for us to enjoy different places in Kentucky without going to a place where it is not safe. And finally, we seem to have even gotten tired of thanking our healthcare workers. When we have 4,000 cases a week, our healthcare workers are seeing a lot of individuals. They're seeing a lot of loss. I think maybe it was the Courier that did a story on a hospital chaplain in Louisville, and I can't imagine what that is like, not only for him, but for every other worker that fights for and sometimes loses that individual that they are trying to help. All right, so I know there is one more topic that people want to hear from us on, and that's the decision by the Kentucky High School Athletic Association. And let me start by saying we're not going to overturn that decision. And it's not because I think that it is a good decision or a wise decision. But if we're going to defeat this virus, we need people, other than me or up here, all over Kentucky, taking responsibility to make good and wise decisions. I have concerns, and I think Dr. Stack will share his, that by starting with some of the most high contact sports, that we risk a shortened season, we risk what I think can be successful plans to get our kids back in school, that we risk every other sport that's going to follow. But we can't be making every decision for what's best for folks out of the governor's office. And it's going to be incumbent on our superintendents, on coaches, on the different groups to make the wisest decisions that they can. And I think Dr. Stack's going to talk about a number of different things. One thing that I'd set the stage for is the SEC, which is moving ahead with fall sports, did delay them until after the start of what our school would be. And for every athlete in a high contact sport is testing them 3 times every week, 2 PCRs and 1 rapid test. So at every program that's going to start up, I want you to really think, are we testing our athletes? Are we doing everything that it takes to keep them safe? Are we putting them first? Dr. Stack?
Thank you, Governor. James, if I could have my slides. You've seen me use these before. I'm going to use it for a specific purpose here today, and good evening or good afternoon. So this is one of those graphs that shows the number of cases adjusted by population for different states. I've got New York on the left. It was one of the highest peaks and one of the earliest and hardest hit. I've got Georgia in the green, Kentucky in the blue, and Vermont down there in the red. The reason I'm going to use this, and the title sort of says it all, disease activity influences the safety of the things we do. If we had no disease, if COVID-19 were eliminated, we wouldn't be having any of these discussions. We'd be back to sports and school and bars and restaurants, and we'd be having a good old time again. But that's not the reality we live in. When you have a disease rate as high as New York, if you go outdoors and you interact with people closely, the risk of getting infected is really, really, really high. When you have a disease rate that's lower, like Kentucky off to the left there, it's not an insubstantial risk, but it's a lot less likely. Some people will say, well, why don't we open schools just like they did in France or Germany or other places? That's why I put Vermont on there. Vermont is all the way, the levels of disease that France and Germany achieved were so well suppressed that it was all the way down there by where Vermont was, and there's hardly any states in the United States who have pulled that off. Now, if you look at Kentucky, we started on the left with a little climb. It looks like a little tiny hill compared to some of these other states. And at the time that was exponential, and we stopped it. And that was a huge success for all of us because of what you did. You listened to what we said to stay healthy at home. And then we went into this really long plateau, which was quite the accomplishment to pull that off for almost 3 months. And then we started to climb again. And that climb was alarming because if that climb kept going, we would have looked like Georgia, or we would look like Arizona, or one of the other states that got hit really hard over the last month or two. But we held it off, and so now we hit a new plateau. But here's the problem. You can all relate to popcorn in the microwave, right? When you put the popcorn in and you push the start button on the microwave, there's no noise. And then you start getting an occasional pop. That's back where we were on the left. And you get about 35 or 45 seconds to a minute into the popping, and it starts getting pretty loud, and you hear all the kernels going off. That's when you get where we are now. When you get up where it is with Georgia and New York, that's where it's like sitting next to a jet airplane engine. It's so loud you can't hear. Where we are now is a wonderful accomplishment that we've been able to suppress the disease and hold it at a new plateau, but we are at a much higher level now. If we take off from this level, it gets out of control much more quickly. Have the next slide, James. So we're going to talk about sports now real quick in this context. I hope that in Kentucky we can be more successful than in other places, but the outlook is not good. So the Big Ten and the Pac-12 delayed their fall schedules. They canceled their fall schedules and pushed sports to the spring. SEC did not. SEC said they could start practicing. Almost immediately, Vanderbilt had positive people on their football team and have suspended practices. Now, Vanderbilt, I think they're part of the SEC, right? So Vandy is part of the SEC, so I'm going to use the SEC guidelines, and the governor's already mentioned this. So in order to go back to play, they're doing 2 PCR tests per week, and then they escalated that, like the governor said. Now they've also added an antigen rapid test to test a different way. That means you have a player getting tested minimum 2, maybe 3 times a week, every week, just so they can play football. But that's really not even the biggest thing. Now, first of all, I'd ask you, if you're in a public school in the state or you're in a private school, do you have the money and the resources and the ability to secure 3 tests a week for the students to play sports? And I think you all know the answer to that. So let's go on to the next slide. There's another set of things that the SEC added recently, and it's because of this. This is probably the reason that the Pac-12 and Big Ten deferred their seasons entirely, but it's the reason the SEC did even more stuff if you test positive. There's a lot we don't know about this disease. I and a lot of others have been absolutely straight about that, and we've said that repeatedly. We don't know some of the more silent but potentially really serious harms this disease causes. We're beginning to learn more. So a sports cardiologist at The Ohio State University shared within the last couple weeks that they think that as much as 10 to 13% of the collegiate athletes who test positive for COVID-19 will develop inflammation of their heart muscle. That's called myocarditis. When the heart muscle gets inflamed, it can get thickened and it can get irritable. If you have that happen, you can have a number of different things happen. Obviously, what we hope is you have a complete recovery, and after a period of illness, you get back to your normal self. But if you have myocarditis, you may find you have substantial fatigue, decreased exercise tolerance, shortness of breath, swelling in your extremities that could last for weeks or months until you resolve. If you have worse luck, you can have sudden cardiac death. If you have an inflamed heart muscle, it's a different route to get there, but we've all heard the stories of the 17-year-old who drops dead on the sporting field. That's why kids have to have sports physicals. It's one of the reasons. You can have sudden cardiac death because you have an irritable heart muscle. I hope this doesn't happen, but it's just going to take one 16 or 17-year-old to drop dead on a sporting field before someone notices that it's not fictional, it's real. So we could say, if you can do the next slide, James. There's just another one. This is the doctor at Ohio State who said this, and that's where he said 10 to 13% had the myocarditis. They did a study, and I haven't had time to review all the methodology of it, but in Germany, that said that when they looked at people in their 40s, they found that 80% of them who had recovered from COVID-19 had abnormal cardiac MRI studies, and 60% of them had signs of myocarditis when they did the study. So I think this is more common than we realize, and if you're really unlucky, if you don't have the sudden cardiac death, which is a really severe, obviously, and irreparable, but less common problem, you could have permanent heart failure that could impact you for a life. Now, if you incur that consequence when you're in high school or college, that's a pretty high price to pay. Women who get pregnant can sometimes have post-pregnancy cardiomyopathy and have problems like this. And I've seen these things in the emergency department. You take a really young, healthy, vigorous person and you rob them of that for the rest of their life. So let's just talk real quick. The SEC modified their guidelines after their initial guidelines. Initially it was 2 tests per week, but then they added the 3rd test on a different technology. But now if you test positive, so those football players, before they can return to play, they're going to have troponin tests. Those are blood tests to see if your heart muscle shows signs of damage, an EKG, an echocardiogram, and an evaluation, in that case, probably by a cardiologist. So if that's a lot to go through to play sports, it's certainly a lot of expense. And again, I know we all care about our kids, so think about just the effort, the cost, the expense, the fear, the anxiety, the worry that goes into this. If I could have the next slide, James. So this is my wind-up slide, and I'm going to make a number of different points on this. So this is 4 different maps, show the state, obviously. It shows 4 different weeks over the month of August. And what it shows is the disease progression. So it shows which counties were hottest with new cases in any given week. This disease does not respect lines drawn on a map. It does not care. So folks want to have local self-determination, give us a metric. I've seen that a lot. give us a number. What's the number? If it's beneath this number, above this number. I have said for months it is not that simple. I wish it were that simple, but it is simply not that simple. And so if you look at this and you look at it carefully, you'll see the areas of the really dark blood red move around. And you'll see that there are places that are light yellow that become dark yellow and become really intense yellow, and then areas of hot red. And you'll even see where counties next to each other or contiguous to each other go from dark red, and then you connect the bridge up on the top there, kind of not quite to northern Kentucky, but above Lexington. And so the point is, if you are next to a county with very active disease, your county could be very active very quickly. When you get hot red, it takes longer to cool off than it does to accelerate up. So here's the thoughts that I want to leave with this. We're working on a number of different things, and we're going to try to get this done over the next couple weeks so that these tools are available. The governor already talked about the detailed dashboard that we'll produce, like we do for nursing homes, but that takes time for the epidemiologists to do really high quality work, so that'll be a little delayed. And for the schools who hear this, because I know a lot of you hear this, we're going to talk with you. I'm going to communicate with you. We'll work through this. But we have created an online survey. Just ask for a handful of numbers. Pre-populate your school name and everything, but we're going to ask you every day to go and fill that in. The number of cases and students and staff and the number of quarantined students and staff. And we're just going to put it up on a dashboard. And that'll be self-reported information, just 4 numbers. Make it available in real time and ask you to report every day that school's in session. And so then we'll have for the public something they can just go and see. And we'll even ask you to consider putting on your own website that little table that just shows those numbers so we're all consistent. And for the colleges and universities, I'll talk to you too here shortly, because we're going to ask you to do the same thing. It's not a lot of detail, it's pretty straightforward, but it will help the public at least be informed. The other thing we're going to work on, and I will own this, I resisted for over a month or longer the call out to have specific metrics by county for people to make decisions because of a table like this or a chart like this. It spreads too much. But we're going to work on a metric, and we'll work with KDE, and we'll try. And then we have a new commissioner who will join us next month, and so we'll work with the new commissioner too to try to make sure, again, it's all done in partnership with the education community. We're all in this together. There's no animosities. It's all of us just trying to figure out a path through this mess. And we're going to work with you, and we're going to come up with some simple metrics. But here's the thing: for all of the rest of the public, for the superintendents, for the folks who are coaches, for the judge executives, as we go down this course, these actions have cascading consequences. So if you see people not complying with masks all the time and not maintaining distance more than 6 feet, and let me be very clear about this, it is both the mask and the 6 feet. It is not one or the other, it is both. You have to have a mask and you have to stay 6 feet or more apart. I just watched the World Health Organization executive director clarifying this, and it's in the CDC guidance. It's both. So if you don't want to get quarantined, you can't be 3 feet apart and wear masks. You have to be 6 feet or more and wear masks. So as we work through this, for all of you in the public, again, love your neighbor, be kind to each other. This is not a time to add all the other burdens, arguments and friction among ourselves. But if you see people flaunting the rules, you should steer a wide course. And if you go to school and you want to stay in school, it's everybody's obligation to make sure folks socially distance, wear a mask, and wash your hands, and follow the rules. Because if we don't, what's going to happen, and I think the governor, the odds are in his favor that he's going to be correct on this, football's going to start, kids are going to start getting infected, people are going to get concerned and scared, things are going to get shut down, and the rest of the sporting teams lose their season too, because it's a high contact sport, and the likelihood of spreading disease is pretty high. So we will continue to work with everybody. I really am grateful. It's been a long journey, and overwhelmingly people have worked kindly, compassionately, collaboratively. I'm very, very grateful for all of that. But as we go to a different place where we use tools that I'm going to say right now have severe limitations and make it very hard to control the disease, everybody shares a responsibility, and the actions that other leaders take will have a larger impact on the rest of us. Because if you start finding the hospitals get filled up, let me just tell you, you don't just unplug. It's not like you unplug the computer and it turns off. for the next 4 to 6 to 8 weeks, the problem continues until the disease runs its course. So these are consequences that have enduring impact that we have to really think carefully about. So we'll keep giving you the best information we can, keep working with you to give you guidance as we're able to, and I continue to be very grateful for the privilege to serve, and thank you, Governor.
And what will be absolutely required moving forward is absolute and full transparency. That's in athletics, that's overall in our school systems. People not only deserve to know, but you're talking about what may be the long-term health of students and student athletes. So no trying to hide positives. Everybody has to work with their local health departments. Whether or not there's a big game coming up doesn't mean you get to argue with somebody over how many people are quarantined. Don't do that and don't try that. Not with the health of the kids that are on the line. All right, we're going to open it up to questions. We got a packed house here. I have some questions here as well. Kick us off, Joe.
So with the decision to not really challenge the KHSA's guidance on fall sports, you talked about a lot of the concerns you have. With all of those concerns, why not challenge it?
The question is, with my concerns that we're putting out there, why not overturn KHSAA's decision? At some point, it can't be every single decision comes to the governor and the governor decides. If we're truly going to beat this virus, we've got to have people throughout Kentucky making responsible, good decisions for those around them. While I ultimately have to lead the overall ship, if we don't have leaders that are out there, it's going to be really hard to do what we need to do to fight this virus. We also have to keep our regulations and restrictions in a certain area that people are willing to live with. I hope with this decision everybody will continue to wear a mask, will spread out, and will realize that this can't be like some of the youth sports where everybody said we'll agree to anything and then the next day weren't doing them. This is one where the referees, the athletic directors, everybody else should be watching every single event, and the moment that something isn't done right, shut it down. You can't have a football team or a soccer team or anybody else in a locker room. That is absolutely avoidable. You can't have a coach without a mask screaming in somebody's face, in a positive way, of course. That can't happen either. We can't have parents in stands, and I don't even know we haven't even gotten there. Without wearing masks, I saw a picture from a game in Indiana. Oh, that can't happen, what I saw in that photo. But now's the time for responsible decision-making with as much information as we can give, because I didn't hear any of these things in discussions before any of the boards that have considered it. Responsible decisions by school districts, schools, coaches, and parents. I mean, right now, my son's not going to play a high-contact sport. And based on what I know, that's going to be my decision as a parent. Lawrence?
What do you think of that plan to be reviewed?
The question is on U of L releasing its plan for fans in the stand, and we had asked them to wait a little bit so that we could have more dialogue with them. We believe there's at least going to have to be changes to it. I believe right now the Louisville plan has more people in the stands than the Miami Dolphins, if I read the two correctly. Now there are different capacities of the two, but that's something that we are still planning on talking to them, and again ask them to wait, but they get to make their own decisions. Tom?
Going to evictions for a moment. What is the status of that federal lawsuit?
So this question is on evictions. What's the status of the federal lawsuit? We have not been able to reach an agreement and mediation with the plaintiffs. We believe that some of the asks there are unreasonable. And so what we have developed is a plan that moves forward. There's a new executive order. I believe that lawsuit is moot, meaning it was challenging a previous executive order that is no longer in place. If they want to challenge this order, they're going to put at risk $15+ million that's out there to help people. Now, do I think it's going to be challenged? I got 100 lawsuits. One more is not going to hurt me.
So, do you
reserve the right to step in, say, in October, if you see that things are out of control?
On sports?
Yeah, and decide that, this is enough also.
The question is, do I reserve the rights to step in if things are out of control, say in October? Heck yeah, I do. While this decision is going to put a lot of responsibility on a lot of people out there to make initial decisions and safety decisions, anywhere that's not sufficiently protecting their people, if we're made aware of it and we have the power to do something about it, yes, we are. I'm not going to let our kids go undefended. Not that that's happened yet, but yes, as a governor of the Commonwealth of Kentucky, if that's required, we'll be there. Let's see, who has the final say? All these are on sports. With at least 2 Kentucky schools switching from in-person learning to NTI within days of opening, do you see this as a caution signal for others to pause in-person learning? Yes. There are at least a school district and 4 different schools across the state that have had to pause. Yes. This is why we said the virus is so hot right now that it's not safe to start. I'm glad that they are moving to it, but it should be a warning sign to every other school out there. It's not safe. Joe?
Which was recently proposed by State Representative Attica Scott on banning no-knock warrants and some other things.
Question is if I support, has it already been filed as a bill? It's a bill that's going to be filed by Attica Scott banning no-knock warrants. I want to see the bill first. I certainly think with Attica being a member of the community that's in so much pain, we ought to look at it. We ought to listen to her and many others. I just received a text from a pastor that I have a lot of respect for on it. And so we will certainly give a strong look to it. My hope, and I know that there's already been a response, I think from the FOP, is that groups can talk. I think we can all say that I believe that we need a police force to keep us safe. We need to make sure, though, that where there are issues or where we can do better, that we do better. And so I'd like to think that we're at a point in time where if we can truly talk and find ways to move forward, we can both support our police officers, especially those that are trying to do their best, while admitting that systematic racism pervades every part of our society, including sometimes our bias as individuals in law enforcement. So let's address the problem. Let's do better and let's be better. There doesn't have to be, there doesn't have to be 2 opposing forces. I'd like to think that real dialogue, but more importantly than that, real progress is possible.
We heard Dr. Stack talk about districts requiring multiple tests, I guess, a week for student athletes. Do you feel like that's realistic?
Dr. Stack had mentioned multiple tests that the SEC does. We will see what the KHSAA recommends. But again, if you're a parent and you're saying the SEC is moving forward, Big Ten is not, SEC is moving forward, what did they do to have to determine that it would be safe for those athletes to move forward? And those athletes are constantly surrounded by medical professionals. They got them down on the field too. What do I feel that it needs to be there to be safe for my student athlete? Certainly if my kids were playing a high contact sport right now, I would personally be taking them to be tested once a week. And what I'd tell them, and I still don't believe it's my kids aren't going to do it right now, but if I was in that situation, I'd say, if this is the decision we make, this is a step that we can take to make you as safe as possible. So again, this is going to come down to everybody from superintendents to coaches to the individual parents and families. And by trying this, we got to be willing to say, even with the biggest game of our season next week, if we had a lineman or go to soccer, if we had one of our forwards that works in a cohort with all of our other best scoring players, and the order there is that they're all quarantined because of their close contact, that is what it is. And we're not going to let that advice, and we're not going to let our desire on sports interfere with it. Same thing with student athletes, is that it's going to be really unfair in some of these seasons if they're either shortened or someone comes down with COVID. You can't hide it because you could harm other people. You can't try to pretend there isn't a test and go back and play. You can't say, I think it's a false positive if you want to go to a number of doctors and work through that. If you've had it, you really need to be cleared by a doctor before coming back. This myocarditis is serious enough. We think that was what the Big Ten canceled their season for. I hope every parent takes that into account. If your child has had COVID, then maybe it switches and says, maybe I thought it was worth it at the start, but now I'm looking at potentially short-term heart disease for my kid. That's something that I hope they really think about. What is the protocol if a business has a case of the virus, and should the health department have to publicly notify customers of the potential exposure? The LHD should let the public know that there was a positive case and that the contact tracers have been notified and are in the process of doing their job. So this is one where a lot of it depends on how public-facing the business is and your ability to get your arms around everybody that may have come into contact. So we're reading you what's generally a good practice, but it's a little bit different if it's an office that a couple of people come into and they can document all of it, or if it's something that multiple people walk up and into every day. But the local health departments are good about going through this process. Joe.
How much communication has your office or even other public health departments had with Catholic schools and how they're dealing with outbreaks or potential outbreaks that are happening there as opposed to the public schools that we're dealing with?
The question is on how much communication has there been with the Catholic schools versus the public schools. The Catholic schools are required to go through all the same processes of reporting, of working with the local health departments. To my knowledge, the local health departments have been in communication with all of the schools that thus far have had to close or have had an outbreak. Again, everybody ought to want the right thing. And full transparency should be required, not just for the health of the students, but for the decision-making of the parents. And listen, I believe it's too early for any of those schools to have reopened, but I don't wish a positive case on any child or any teacher in any school. And so I hope they're trying to do it right. When a problem emerges, I hope that they embrace the local health department, not physically, we're not allowed to do that, but heed the advice and do the right thing. It is really important, because once you know that COVID's in the school, and listen, right now, COVID's walking into every school, every one. Once you know that it's there, you got to take those steps. Lawrence?
There are concerns about major protests planned for tomorrow night in Louisville. Your comment on the concerns about the protest, and is the state providing any assistance to LMPD?
The question is on, there's at least concerns about major protests going on tomorrow. So the most recent information that I have is that protests planned for tomorrow are planned to be peaceful, and we certainly hope that they are. The Kentucky State Police is in communication with LMPD, and that communication is in case lives or property are threatened. Right now, we anticipate peaceful protests, and what we see is that the leadership out there that is in Louisville is, I think, pushing very hard for those peaceful protests. No, not at this point. Well, not that otherwise aren't already in Louisville. We have a certain number of state police that work in Louisville. We have a post that's there. But as of this moment, to my knowledge, there's not a heightened presence. No. Tom? That last one is any request for the National Guard. No, we haven't received that. And to the extent that there would be, and we haven't had one yet, there are certain things that the National Guard can do in the future, protection of certain buildings that are out there that otherwise LMPD does. We would see future operations, if any, at freeing up more LMPD officers.
Okay. Some businesses in Louisville have announced they are closing tomorrow because of that threat. Do you have any advice to them about that?
The question is about businesses that may be closing tomorrow in Louisville based on concerns about this. If they believe that that is in the best interest of that business or their personal safety, I never want to tell people not to do that. So people that are making wise or trying to make the best decisions they can. But what I'd say is I think it's very important that not only protests are peaceful, but I think that there is a lot of support out there for many of the messages that are being made. And my hope is that this investigation can hurry up. Again, a lack of information being out there creates a vacuum where people's emotions, sometimes false information, can seep into and can heighten those emotions. The sooner we reach a resolution, the better, and/or just more information on the process that's going forward. I believe that if you tell people about the different steps if you don't believe you can tell them about the details, if you tell them at least about the steps and what you're waiting on, that at least can help. All right, Joe, last one.
Are all high school sports teams, are their schools required to tell you if X number of students, athletes have tested positive for X sport? Are they required to tell you that?
So the question is some clarification. Every school is required to report to the local health department and up to the state the number of positives in their school, and then the local health department or the state working with them has to identify if they are in an area where they could spread, including those sports teams. So we do need to know, as the state and the local health department needs to know, if it involves a team. There's a volleyball team in Louisville that has had an outbreak, and they worked with the local health department, and after some discussion, reached, I think, the right decision on quarantine. But that's just one example of how it's going to work. In the end, the local health department is going to be communicating with that team. It's got to be public health officials that get to weigh in on who needs to quarantine. That can't be made in the competitive spirit that may be out there in games that are yet to be played or what's going on at the time. So surely, if there is a positive in a team, the number one thing will be the importance of the safety of all the athletes, that everything else is fully on pause and we can do the right thing. And you know what? People are going to have to do the right thing. That's part of this deal. And I hope everybody will. All right, everybody, thank you. We are a bit over time. We need your help. We got to have people that are everyday leaders if we're going to beat this virus, making good decisions. They can't all come to this desk. This podium. We don't beat the virus if that's the case. So let's get out there. Let's protect each other. Let's put each other first. And we cannot have another period like the start of the summer where we get worn out, where we decide we're just too cooped up and we just stop doing the things that protect each other. This virus right now is aggressive. It's out there. The numbers suggest we're losing 80 people a week based on the number of cases. Let's be strong. I keep thinking that my grandparents, if they were here after going through what they did in World War II or the Depression, would tell us to suck it up, to know that this challenge for us we can defeat by staying home and watching Netflix. They had to go to a war overseas. They had to sacrifice so much. They had to live through so much. Let's make sure that we don't just honor their sacrifice, but we do the right thing to protect our people during this time of need. We'll see you tomorrow at 4 p.m.